Welcome back, everybody. The media is hyping up a new COVID variant. A razor blade throat is what they are calling it. Is there anything to worry about, or is this just more fear-mongering? Joining us now to talk about that and much more, world-renowned doctor and chief scientific officer at the wellness company, Dr. Peter McCullough. Dr. McCullough, thanks so much for being here.
Thank you.
Okay, so a new COVID variant is what is the virility like? Is this something we need to worry about? If somebody starts feeling a scratchy or sore throat, do they need to panic?
You know, it's a variant that has now a name and actually a description. It's NB.1.8.1. It's a Omicron subvariant. It's been called Nimbus, or a razor blade sore throat. And I think all of us have, had a viral illness where the sore throat is severe. Remember, a virus is in the nose for about 5 days, silently replicating, and then the lymphatics drain back to the throat, and we feel a sore throat first. But when we feel a sore throat, the virus has actually already been in the nose for 5 days. So I got to tell you, this variant is a strong call for nasal sprays and gargles to be done routinely twice a day. Don't wait until you're sick, because the virus could be there even today. And if it's disrupted with a nasal spray and a gargle, and nasal sprays can be, iodine-based, xylitol, colloidal silver, the whole variety of gargles work. That's the best prevention measure.
So if people want to do a gargle or something like that, I've seen various recipes online, obviously, especially with colloidal silver, you have to very, very strongly dilute it. What do you recommend? Is there a specific one you recommend?
Yeah, at the wellness company, we feature Immune Mist, which is saline iodine-based Immune Mist nasal spray. Throat spray is great when you're traveling. Outside of the wellness company, one of my favorites is Clear. It's a xylitol-based one, XLEAR. And then the companion gargles called Spry, S-P-R-Y. They have very good randomized trial data. They clearly prevent COVID-19, common cold, flu, RSV, and they're good actually for kind of nasal hygiene and as dental hygiene. So everybody should be doing twice a day nasal sprays and gargles. Don't wait until you get sick.
I love that. Okay, I want to move on to some recent news within the last 24, 48 hours or so. Two major companies, General Mills and Heinz, have stepped forward and said, we're going to get rid of the artificial dyes in our food. This obviously would have never happened were it not for Bobby Kennedy and a whole slew, Jay Bhattacharya, Marty Makary, a lot of these people who have stepped forward in this movement. How consequential is this going to be for just making Americans healthier in general?
It's good news. Both companies were on the way to doing this. They had initiatives, and we're talking largely about yellow and red dyes. Both of them have been linked theoretically in animals, chronic exposure to various cancers. That's disconcerting. And there are clinical data showing they're linked to hyperactivity in children. That's another reason to get rid of it. So I think it's a welcome change. The companies have said it's not going to be till 2027 until they're out of the products. But, these are positive changes. So good to see them.
I got to say, 2027 until they're out of the products, that's 2 years from now. That means that they are using components that are 2 years old by the time 2027 rolls around. But I'm going to sidestep that for a moment. And I want to get something from you regarding the topic that I had with my last guest regarding trans surgery. I think for so many of us who oppose this, we see the savagery and the mutilation and, at the very least, what can turn someone sterile if they are on puberty blockers at a certain age. But I know you've got some strong scientific data about this, so let it rip.
It's true that the data have been coming in now for at least a couple decades. We now know that most children who are beginning this transgender process, they have gender dysphoria, they actually have background autism spectrum disorder. The majority do. So children with autism are suggestible, they feel ostracized, and normal children essentially wouldn't do this. Because their gender orientation is solid. So it's important to understand that transgender clinical care, in a sense, is preying upon children with autism. We have a neuropsychiatric disorder, and all the data suggests that transgender care is sterilizing, it's disfiguring, it's permanent. It increases the burden of psychiatric disease and increases mortality from all causes. More than half the states have banned it in the youth, and now the Supreme Court is backing up Tennessee, which in a sense is backing up Texas and the other 25 states, and President Trump, who has also weighed in with an executive order. So I'd like to see this completely eliminated from as a threat to our children. Above all, do no harm. I know that children and adults want neurodiversity and gender diversity, but it's not something that is clinically appropriate or prudent. We can't have harm done to autistic children.
Yeah, absolutely. Sir, before I let you go, I want to ask you about pharmaceutical ads. I saw one this morning for something I had never heard of, CIPD, not COPD. And I thought to myself, well, that's something novel. I never even knew. I still don't even know what that is. But we are only one of 2 countries that allow pharmaceutical ads on TV. Is this something that RFK needs to look at and possibly consider doing away with?
RFK actually has a team now. So Bernie Sanders and Angus King in the Senate are moving with RFK to ban pharmaceutical advertising. The reason why this is so important, and Tucker Carlson exposed this now a few months ago, is that when a pharmaceutical company is advertising a drug for an obscure problem, like you mentioned, typically with a complicated acronym, what they're doing is they're essentially buying control of the entire media platform and the narrative. So you can imagine if Pfizer has an ad spend for their blood thinners or other drugs, they can actually have conversations with CNN or MSNBC and say, we don't want any negative stories about our other Pfizer products, like our vaccines. And so the media platforms have not been free to review safety of products because of pharmaceutical advertising. It needs to go. United States and New Zealand are the only countries. It's doing great harm. Getting rid of pharmaceutical advertising will benefit medical freedom of speech, and I guarantee the mainstream media will start to have much more fair medical reporting.
Yeah. I mean, look, I work in media. I've seen it happen at other networks where, and sometimes it's not just pharmaceuticals. It can be a soda brand, and they expect a certain type of coverage when they put in a big ad buy. Yeah. All right, Dr. Peter McCullough, always wonderful talking to you. Thank you so much for being here, sir. And remember, go to twc.health/justnews, and you can save 10% by using the promo code JUSTNEWS. That's twc.health/justnews, and use the promo code JUSTNEWS to save 10%. I have that blue kit right there on the screen. I love it. It has all of the essentials that you might need, and then they have a whole other host of other kits as well. So go check it out.